This is Dr. Analak from thegentlendentist.com. Here at our office in Shelby Township, Michigan, we do a whole host of different types of treatments. And today we have Doug, and Doug has agreed that we can videotape us doing an apical surgery on a tooth that had a root canal done, and this thing has been constantly giving him problems over time. And so I'll show you on the x-ray here. So this is the x-ray right here, and this is his molar tooth. And right in here is he's had this chronic area on this one root of the tooth that's been constantly getting reinfected. And so we're going to do a procedure where we actually will take part of that filling of there, and we're cleaning out the infection. We're going to put a grafting material inside of there. And so Doug has agreed that we can go ahead and do that. So I'm going to show some details about what's going on. So what we're going to end up doing here is a little bit of graphics. So if you don't like any blood, then don't watch this, please. You can stop right now. But you can come on in and I'll show you some area that we're doing here. So this is, didn't suction right now? So this is the area right here that we're working on. This tooth has had a root canal a number of times. And right in here is where we did we called a flap right here. And right in here is where it's, we can see there's, right in here, this is all soft, and this is actually an infected area right here. And so we're going to clean this out. I have Doug plenty numbed up, and we're going to clean all this infection up that's created like chronic problems for him. And so we're going to clean it up and then go from there. So this is the area right in here in the root. There's 3 roots on this tooth, and this root comes down in here. And as I clean out the infection, then it will expose the root a little bit better. But I want to clean all this infection out and see how that's going from there. Okay, so this is actually the one root of the tooth. You can see it here in that little orange spot right there is actually part of the root canal, the filling that's filled the root canal. And so what we're going to do is we're just going to come here and just shorten that up a little bit in that area, and then fill that up from behind, and then fill this area up. This is actually, his sinus is very, very infected in this area, so he's having some problems with that in the past. So we're going to go ahead and do that. So right in here, this is called a piezo scaler, and what it does is actually a physical instrument that. Okay. So this is the material right here. It's called MTA. It's funny because this is almost like you consider Portland cement. Yeah. Sterilized Portland cement is what this ends up being. So, but it's amazing, they found it to be very compatible with the body. We can do all kinds of like repairs in it. So it's got to remain a little damp, and so it will remain damp. What we're going to do is, this is a resorbable, in other words, it will shrink down. Since he actually does have his sinuses there, but his sinus cavity was so inflamed and infected that it literally poked right through here. He's been having problems with it for years. So what I'm doing here is, this is just going to be a little baffle. It's going to prevent this grafting material that we're going to use from getting too far into where the sinuses are. And
I see what you're saying. Gotcha. I can open the set. Doctor?
Okay, do you have that scintigraph mixed up?
Yes.
So we're going to use a synthetic grafting material that contains the components to turn this into bone over time.
Yeah.
Is that cadaver bone?
No, it's not.
Sometimes.
It's called calcium triphosphate.
Carl.
And so we're just placing that and place that in here. So we went ahead and completed everything, and we put some stitches in. So right now we put some stitches in there, and we put this. Actually, it's a surgical super glue, and it's going to hold these stitches nice and tight. But the flap we had to raise is like this, and that's going to approximate now, and it's going to heal, and it will allow it just everything to heal and to heal up. So so this is this procedure come to a close here, literally a close. And my hope is for Doug is that these I'm going to give him some antibiotics to take, and the grafting that we did and the placement of that membrane, everything's going to stay stationary and allow bone to heal in that area, and hopefully we'll see a good healing and recovery from that. Okay?
Very good.
All right. I'm going to sit Doug up and see if there's any comments you want to make about. Now, how long have you been having a problem with
Sinuses is about 2 to 3 years.
2 to 3 years.
The infections with the above the gum line there probably within the last 6 months.
Yeah. So it's basically the sinus infection has made its point to it's almost it's even gone beyond the sinuses. So hope that area and also teeth can be responsible when teeth are infected and going near the sinuses. That can also create actually sinus infections from the teeth. So the teeth and the health of the gums, and now it's really critical for long-term health is to take care of your teeth. But if you have any questions about things, dentistry, you can contact us at thegeneraldentist.com or 586-247-3500. And once again, we're located in Shelby Township, Michigan. Thank you.